Dr. Steve Weiner from the Aesthetic Clinic. We're in Santa Rosa Beach, Florida, which is near Destin and Panama City. And we have right here my friend, my long-term friend, Miss Jennifer Cerrone.
I know, it's been a long time.
It's been a long time.
6 years now, right?
Yes.
I trust them more than anybody.
So Jennifer is what, 30?
I'm infinite.
Yeah. Okay. We won't say.
In my 30s.
Yeah, she's in her 30s.
Mm-hmm.
And what we're going to do today is we're going to do a little bit of enhancement, but this is really fine enhancement because she doesn't really require a lot. And what I've gone over with her is that she has a really nice V to her face, which you like. Mm-hmm. That's the V that you want. That's a youthful V. But when you look at the side, and you can look right here, the mid cheek is a very little bit, it's a little bit flatter than it should be. So we're going to put a little bit of filler right in here. And that's going to help.
Yeah, when I smile.
Yeah, that's going to help lift in the nasolabial area. And when she smiles, she has a little dimpling right here that's going to help that as well. So it's a very subtle enhancement. And she also has a little bit of fat loss right here on both sides, some malar leaves. So we're going to put some right there and right here. And we're going to do that with Bellafill. The reason why she wants Bellafill, because Bellafill is an extremely long-acting filler, probably permanent. I actually have 8 syringes in me. And she lives in Utah, so she doesn't get out to see me all that much. This is her 4th time here, but so the Bellafill will be basically a permanent solution. We're also going to do some Dysport, and that's like Botox, around her crow's feet, in her glabella area, her forehead, her bunny lines, and her platysma, which is her necklines here. So we're going to do that all over. And then we're going to put a little filler in her lips. And we'll show each of these in a separate video. But the first one I'm going to do up here, and I do it with cannulas. And cannulas lead to less bruising and less swelling, and they're a lot safer. They have a lot less risk of vascular injury and a lot less bruising. And what Sandy is doing here is she's numbing her up with this cold device called Artec. And that brings her skin down to a temperature of about 38 degrees. I feel that this is even better than topical anesthesia because it penetrates a lot better. You don't have to wait. She gets immediately numb. And then we do the cannula. So we'll start right here. I'm going to lean you back slightly. Mm-hmm. And Sandy's going to clean the skin right there. I'm going to turn you slightly. And we have a vibration device as well. And then I shake the skin, and she ends up hardly feeling that entry site. And I use a 22 gauge cannula from Softfill for this procedure. And chin up just a little bit. And I'm using room temperature Bellafill that's been taken out of the refrigerator. And there's a nerve right there that we go for, and it gets numb pretty quick because Bellafill has some lidocaine in it. Sorry. But now I'm about right here. I use my other hand as a guide. We're just about done with this area over here. You okay?
Mm-hmm.
So I'll show you once I'm done. And so what we've done here is we've created a little bit of a improvement in the medial aspect because you have fat pads here that end up being lost, as well as the bone being reabsorbed as you get older. So you're doing okay right now?
Mm-hmm.
Okay, so then I'm going to put a little bit right in this area, and I'll have Sandy numb that up for me. So as we're waiting, again, so she's numbing it up. Our tech device from the company is called Thermatech, and it gets it down to 38 degrees. I feel this is better than ice because there's no dripping. It keeps it at a constant temperature. And when the patient leaves, they're not all numb. There's not grease on them. And so that you typically get with topical therapy. Now, Bellafill comes in a 0.8 cc syringe, and she had to have a skin test prior to this because the Bellafill contains some collagen that is not human, that there's a 0.5% chance that people are allergic to it. So you do the Bellafill test 3 to 4 weeks prior to getting the injection. And you do it on their forearm. And so right now I'm in the area I want to inject. I want to inject right in this area right here. And so I'm just fanning it in this area. And it contains lidocaine. And the Bellafill is made of 80% of this collagen I just described, and 20% PMMA, which is polymethyl methacrylate. And that is what stimulates your own collagen, and it's not degraded by the body. So we're just about done here. I'm just putting a little bit in her upper cheek. And we're done. So by putting stuff in the cheek and all that, that helps lift things from down here. And that helps with the neckline, the marionette line, and all that. And you can see there's going to be no bruising and minimal swelling. This product is great for swelling because collagen helps prevent any swelling and bruising. So there we're done with this side. And you can compare the two sides here and see she's less hollow over here than over here. And if you do it from the side, she has more projection from the side on this side than she has on this side. But it's a very subtle improvement because she's so perfect to begin with. So the other side's going to be exactly like this side, so we don't really need to show you that, and we'll cut out. But how was that? Not too bad, right?
Wasn't too bad.
Okay,
it's
good.
okay.
And right now you're just a little bit numb.
Yeah.
And she'll be numb for approximately a half hour to 45 minutes because of the anesthesia in here. And then we recommend that you don't do a lot of physical activities today to prevent further bruising, if there were any bruising, but there won't be. But just to allow things to settle down. We recommend massaging the area beginning late tonight or tomorrow for 5 times a day for about 5 minutes. And that helps make sure that the fill is very smooth. We do that with Bellafill, and we also do it with Sculptra. All right, so we'll cut out here and we'll cut to another scene in the near future. Thank you.